And we were talking a lot about interpreters and why it's important, and the stories that you see every day, whether it's nutrition, obesity, diabetes, and also your personal stories, the stories of where you start, how you came into Language World, and where you may be going after Language World.
Well, so far, being a medical interpreter is one of the best things that happened to me since I came to the United States. I came here 2 years ago, and within my first year, I started applying, and I got my interview with Language World, and I started to feel like I, as a person, matter. I can help my community, I can apply my language skills to help somebody who came here so suddenly, and they didn't have the time to learn the language, and I feel that I'm doing a lot to help them.
I can't tell you how many people have started with me as sort of the raw material of a bilingual young person and are now PhDs in psychology, are medical doctors, are physician's assistants, nurse practitioners, pharmacists, RNs, all the way down the line.
From my point of view, I think it's very rewarding to have this job, to be providing this service for people in my community and in need of interpreting, because it's very rewarding to step out of a doctor's office or a doctor's visit knowing that someone that you interpreted for is very thankful and grateful for what you do for them, because they're walking away from that appointment, that doctor's appointment, that doctor's office, with knowledge that they really value and some new piece of information that they'll apply to their life.
Medicine is very expensive, and when patients don't follow their medication regime, or if they don't follow their treatment options, what happens is that people get sicker. And when people get sicker, it becomes more expensive to rewind what happened and to bring them back into a place of health.
I actually see there's a need for the interpreters in the medical setting, because usually Koreans are considered to be very educated and that they don't need many interpreters. But actually, I witnessed that there are population actually need interpreters.
Patients feel really happy. You can see the smile in their faces when they are able to communicate their needs, communicate their problems without saying it in the same language and being understood. And I think they feel safe as well.
Just like any communities, older people now, their children are busy. Even if they're willing to come and help, they're busy, they have jobs to do. And like any community, it's always better to have a professional interpreter.
The interpreter provides that critical communication link that bridges that understanding so that the patient can be empowered to take care of themselves, which is truly the best option. When there is a high degree of patient satisfaction and provider satisfaction with the understanding of what we're doing in that therapy or in that medical treatment, then we get a healthier communities. Then we get lower costs. Then we get a place where everyone feels like they're on the same page, and it's patient-centric, patient-focused, which is what all of medicine is going to.
Children don't have good Korean, especially with the medical term, to communicate with the parents, but then the parents, they know the Korean perfectly for sure, but then they're not able to express all those information to their children. So there's some communication gap. So I felt that I kind of fill in that gap between generations.
I believe the interpreter does save lives. I believe the interpreter does it one word at a time, one meaning brokered at a time.
They know that there's somebody there that actually being their voice, the real voice. They're not changing things around. They are expressing with the same tone of voice, with the same words, without omitting information, without adding anything that hasn't been said. They feel safe in that environment, and that is very rewarding for us as well.
It is not a handout. It's not something that should be an afterthought or should be somehow discounted, but it is a professional level service delivered by people that were carefully selected, carefully screened, prepared, trained, carefully monitored and supervised so that their level of interpreting remains at the highest standards, because our patients and our providers deserve nothing less.